Hello everyone. Today we are going to record a new podcast episode of our project Feeling Alive. So today we're going to talk about resource and support when talking about mental health. And today we have three guests, two students, Tim and Gabin, and also Ophélie. So I'll let you introduce yourself, starting with Gabin maybe.
Okay, so I'm Gabin. I'm currently a student at INSA in mechanical engineering.
So my name is Timothée, and I'm the same as Gabin.
And my name is Ophélie. I'm a school nurse at INSA since 3 years.
Okay, thank you. Thank you all. So let's start with this very first question. Maybe this question will be more for our two students here. So what kind of mental health resources are you familiar with?
I know there are some that you can find on the internet, as well as, more precisely, in our school, INSA, where you can check with the nurses and talk to pretty much anyone, and you'll get advice on how to meet a professional.
From internet, you say? So some information you can find on internet from our school?
On internet you can find, but in our school you can also find people who can help you, like nurses who can get you in contact with a psychologist.
I think I'm not really familiar with any mental health resources because I don't use them. I know there are some, like nurses, psychologists or anything, but yeah, I don't really use them.
Okay, you're more, when you're not feeling good or well, you prefer speaking with your friends? Or
Yes.
Sports. And how does it make you feel, or to ask for help or support? Do you feel comfortable asking for help or support regarding mental health?
I think I don't always feel really legitimate to ask for help. For example, if I don't feel good because my what I study is hard or anything, I just try to work harder, and I sleep, and the next day it will be better or things like that. So I think I don't really feel legitimate to ask help for things like that.
Because you think that there are things, or maybe people are suffering more than you? And
yes, there are that, and also it's maybe part of what we are doing. Like, it's normal that it's hard, everybody is feeling that, so I just have to deal with it.
Okay. And you, Tim, how does it make you feel? Do you feel comfortable asking for help or support?
I think I'm pretty much the same as Gabin, in the way that when I have exams coming up, I know it will be hard, and even if I'm not feeling well during that time, I'm just telling myself to power through this period, and I know it will be better when the exams are over. No matter what happens, at least I'll be chilling in a way.
Okay, thank you. So for instance, you're not using digital or online resources. I know that, for instance, some person that sometimes they use ChatGPT to ask for advice or to help them feeling better. But so you do not use those kind of stuff. You prefer like waiting for a better moment to come, to arrive. Or
I feel like a lot of people are struggling really hard, and I think it is not my case at this point. Like, some of them are really having huge amount of stress, and this is pretty much not what I'm feeling on the daily. So I don't think I'm legitimate to, I think, get help on the same level as these people when they are feeling way more stuff than I do.
okay, so thank you. And So we have the pleasure to have Ophélie today, who is working for INSA. And Ophélie, you used to receive some students in your office, students not feeling well. So what kind of support INSA can propose to the students, or what kind of services you offer?
So we are 2 nurses at the nursery, and firstly we meet students to talk about everything they need. Gabin and Timothy said that they don't feel legitimate to talk with us, but we save all students they need, and even if it's a little problem, we are here for you. And sometimes this meeting with the nurse is enough to feel better, but sometimes it's necessary to refer to a psychologist or a sophrologist. We work with her. Sophrology is a combination of relaxation, breathing. It promotes well-being, and it will be reduce stress. It can also affect your sleep and your diet.
Do you have a lot of students coming to your office, that students just saying, I'm not feeling good, or I'm not in a good mood, or I'm stressed, and so you gave some advice to go to sophrologic specialist, or to do some exercises?
Yes, we have a lot of students come to see us, principally between October and February, and sometimes we need to send this student with a psychiatrist, and sometimes just talk with us a few days, and they will be better. With that, we have some workshop for well-being students, like Wellness Week. You can participate every year. We offer various workshops like massages, like sophrology, like art therapy, or power naps.
Mm-hmm. And this week is for everyone. Like,
yes.
It's not only for the students coming to your office, but this is kind of public event happening twice a year, if I'm correct. Okay.
We also organize les cafés étudiants once a month, where we talk about different themes like sleep, stress, access to healthcare. We talk about sexuality. And since April, we have opened a relaxation room at the nursery, where there are 4 armchairs, 2 massage chairs, and a pair of massage glasses. And this room is opened for all students to relax during the day, during the hours of opening of the nursery.
Okay, so for instance, Tim and Gabin, did you know about this room, that you can go for this room and just chill and relax and having massage? Have you ever been there or not?
I never been to this room. Unfortunately, I don't take the time. But yeah, I know about it.
I've been there once with friends, and it was really a great moment where I could just relax and let go of pretty much everything, to just close my eyes and feel better.
Yeah, that's nice. It opened only like few months ago, if I'm correct.
Yes, since April.
Okay, April. Okay. And also, because we talked about psychologists, maybe we can mention that the fact this year, 2025, mental health is like the main topic for the French governance. So they offer like a free check with a psychologist specialist for students and young people. Can you talk about this?
Yes, I try.
This program.
students or not students can use the program they name. I forgot the name.
Yeah, I can't remember, but we can check and.
Yes, but there is a program, and you can have 12 appointments with a psychologist for free during 1 year, and you don't have to go to your doctor before.
Okay, you don't need to have a prescription.
Yes, no,
okay.
No, and you just need to take an appointment with Amélie.
Okay, with the French social welfare website, amélie.com. Okay,
yes.
Good. So, like, we heard a lot of those kind of resources and support, like internal support from INSA, the action we made here, but also the national one. So I can go next now with this wrapping up question. So Tim and Gabin, according to you, do you have any suggestion for local or mental health support? You heard some example here, but do you think of other initiatives that can be helpful for young people? Have you something in mind, or?
I think that instead of trying to compensate the issues while people have mental health issues, it could be better just to not create those, like doing more light schedule for students, letting them have more time for them, and allow them to just have days of really with nothing and everything. And I think it could be a good beginning to let them more time.
Okay. Try to remove the stress from the beginning.
Yes, I think.
Okay.
Instead of just trying to help them while they are completely destroyed by stress. Okay.
And you, Tim, have you got any suggestion or idea to have more support or make some other kind of initiatives?
Yes, in my opinion, rather than doing more of initiatives or else, we should focus on letting people know that going to a psychologist is not an issue in itself. Like, anyone can go to see one, even if it's not that much of a huge problem, because going to see one early on in when running in some kind of trouble in your life will likely help remove the problem when it's not really deep in your life. And in my opinion, for society to know that would be a huge step forward, in my opinion.
Okay. And you, Ophélie, I can finish with you. Have you got other initiative or health support you're thinking of, or maybe one activity that you will implement for the next week of wellness or well-being in INSA, something?
Yes, I don't have more activities than last year, but we will organize a new wellness being week on November this year. We will make massage, and I don't remember all activities we are planned for the year.
But the idea also of this project is to have some students coming with new ideas, the students of this project who have taken part of the training. I hope they will propose some activity they learned in Lithuania thanks to this Feeling Alive project. So I hope they will come with new ideas and improve or maybe like give more activities to this week of well-being.
Yes.
Okay, then thank you all. Thank you for sharing your thoughts, and have a nice day.
Thank you.
Thank you, Vincent.
Thank you.
Bye bye.
Bye.